Hi, this is Dr. Leslie Manson.
I'm Dr. Mark Rudy.
I'm Dr. Freitas.
This is Dr. Nicholas.
Dr. Curl.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're still here.
We're still here for you.
We mental health providers of Arizona wanted to extend our warm support and these brief educational videos to reduce stress and navigate challenges. If you need help, please reach out. We're still here for you.
To Minding Your Mental Health. I'm Dr. Melton, here to give you the skills, tips, and strategies to build your resilience and stand in empowerment. Today's segment, we're going to be focusing on mental health or behavioral health professionals and professional grieving. In light of the COVID-19 pandemic, I really believe that this is a topic that warrants, conversation, attention, and consideration. I had a conversation recently with a colleague of mine in New York where she was sharing with me that she and some of her other colleagues are experiencing the loss of their clients from COVID. And it really struck me when she shared this because it was an aspect of grieving that I hadn't really thought about or considered. So today, we have a special guest with us, Dr. Melissa Flint, who was going to help us to kind of understand and think through the process of professional grieving in light of our current circumstances. Dr. Flint is a licensed psychologist in Arizona, and she is a certified expert in thanatology. In other words, she works with and specializes in people that are experiencing death and grieving. And so, introducing Dr. Flint, thank you so much for being here and willing to share your time and your expertise with us.
Of course, it's my pleasure.
All right, so let's jump right on in to just, the conversation. And I think
Perfect.
really, nationally, with COVID conversations and the reports and the numbers that grief and bereavement are becoming more and more part of our daily conversations, right? And in many ways that can be really helpful in the sense of normalizing emotional experience, but I'm wondering, what might be some things we should be considering about grief as it's in our conversation daily now?
It's a really great question because I think in my private practice, at least, I'm seeing kind of three different things happening. I'm seeing the COVID specific grief where they've lost someone or something, maybe their job, something related directly to COVID. Then I'm seeing another subset of people who have other grief losses that are now being highly triggered by the current events. So they don't know anybody who's died, but they're triggered. Then there's this third kind of unique category of people who have experienced traumatic loss normally. That's the people who are most often talking about this to me, where they're feeling the term grief is kind of being over colloquialized or overused, and it's diminishing their feeling, it's taking away their grief. And most often I'm hearing things like, the people are posting online and they're saying that they feel like they're grieving because they have to stay home. And this client will recoil and say, that's not grieving. So I think there's an interesting phenomenon. Anytime we're talking about grief, it's a good thing because we recoil as a society from talking about the death stuff. And even as professionals, we often don't approach that topic. But these are unique facets of grief and the grief experience that, especially with the COVID, we've never seen this before. So we're all trying to navigate this kind of unknown territory.
And so when we think about, kind of this larger conversation around grief and all these different aspects and the experience of it and how do we make sense of it, I want to shift to talk about the professional grieving aspect, right? Yeah. So mental health professionals, we have, established relationships with our clients, right? And though we're not family or maybe not even friends, we still have an intimate and unique connection and hold space for our clients. And so what is the process or the experience on the professional and as human beings that we should be thinking about or considering when we're learning about the death, how we learn about the death of a client from COVID?
Yeah. I didn't really ponder this until really yesterday when I started thinking, how would I find out as a professional that one of my patients had died? Most of us have moved to telehealth platforms now, so that might be new, might not be new for some of our colleagues.
Mm-hmm.
But I would, go into my waiting room and wait and wait. And then after 10 minutes or so, call, leave an email. I would get no response clearly.
Mm-hmm.
Who would notify me? How would I find that out? Would it just be a random phone call to my practice? Would a family member actually think to notify? Would I see a name in the obituary section of my local newspaper?
Mm-hmm.
There's so many pieces to this. And when you think about the professional relationship, which you alluded to already, no, they're not family, no, they're not friends, but they are even more intimate in many ways than some of those relationships in our lives, because we create a sacred space for them to talk about their deepest, darkest secrets.
Mm-hmm.
And that work is unfinished if they die in the middle of our time together, right?
Mm-hmm.
So
Mm-hmm.
there's grief over the loss of the person. There's grief over loss of unfinished business that you had hoped to companion them to reach.
Mm-hmm.
There is practicalities, honestly, of you've got openings in your practice, and I don't want that at all to come across as minimizing the physical loss, but the reality is that many of our fellow clinicians are having a difficult time figuring out, should I fill that spot? Is there an appropriate waiting period? How do I not dishonor the legacy of that patient in my practice and in my professional life?
Right.
But the reality, you've got bills to pay, and there's hundreds of people waiting for support services right now.
Mm-hmm.
Those are really tough things to balance as a professional, as a caring professional. It will hurt because we care. I get worried when my professional colleagues say, oh, you know what, you win some, you lose some. I get petrified in my soul, because that shows kind of a callousness or maybe a burned out feature, and they're not coping well.
You mentioned earlier, connected with this, that, as a society, we don't talk about this death stuff very much.
Mm-hmm.
And it made me think about, professionally, how many, training programs, graduate courses, or even practical experience really focus in on professional grieving. And I know that, in my training, there have been a couple of conversations that I can recall around when you lose a client from suicide. Yep. And even that was kind of a taboo topic, right? Because it then brought up, like, what did you miss? What did you not do? Like, did you check the documentation? It comes this autopsy of the work that you did, right? Yep. And not necessarily focused on the loss itself. Yes. So in this situation, the loss through COVID, I'm wondering if we as professionals maybe have not had the opportunity to get supervision or training to think through from the position of the provider. What does grieving look like? What are we allowed, or how are we allowed to grieve?
Yeah. And what are the ethical mandates of that? What should we do? What should we say? Who can we contact? Who can we not?
Right.
This is, I think our colleagues who have worked in palliative care and worked with clients who are actively dying might have a little bit of an edge up on us, because clearly they've experienced the non-suicide death of patients over a course of time. Right. But this is even different than that. This is like the Grim Reaper coming and just snatching this person off the earth with no preparation, no time to process. And we often focus on the process only of the client, but there is a process in that for us, because we are also human beings.
Right.
And I would hope that you have connection with that soul side of you as a practitioner. Otherwise, maybe we should be rethinking what we're doing. And so when we have that death happen that's just been snatched, I think there is a completely different phenomenon happening that none of us were trained for. Even as a thanatologist, the sudden loss was always about suicide or maybe a car accident, something like that. So we had it sprinkled in. Right. But some of our colleagues are going to have a quarter of their clientele, or a half, God forbid, lost to this kind of, unspoken demon that is named COVID.
Yeah. And that brings up another point in terms of, what grieving process we actually go back to. So in the absence of, formal conversations, your training in terms of, professionally, this is what you do, this is what you don't do, we go back to our personal experience of how we grieve, right? Because before we became these mental health professionals and got the licensure and the training, we were people that experienced life, right? And so I think that's another piece then that we have to pay attention to, like really understanding how we personally grieve.
And also recognizing that as human beings is part of this process, not only just a professional persona, but a human persona under that. If we have unresolved griefs that we haven't dealt with, we are absolutely going to be triggered. And the expectation that somehow we aren't is pretty naive. And I have some colleagues that kind of have that superhero persona, right? They can handle everything all the time. It'll never hurt me. It'll never crack my surface. And I'm worried about those individuals right now because maybe they had 1 or 2 death-related clients before, and now they have 20. That's a different type of work with people. And I think that we need to focus on the fact that we have our humanness and our professionalism, and those are intertwined together. They are not necessarily separate entities. Right. And the same things we tell our clients, we need to be doing ourselves, and we are often not very good at that.
True. So true. So what are some of the things, just kind of some of the tips or strategies that you would recommend in light of, COVID-19, anticipating more and more losses as mental health professionals of our clients?
Yeah, I think focusing on your mental health and self-compassion as a professional and as a person is critical. We need to catch ourselves when we're saying things like, I'm being held prisoner in my house. You're not being held prisoner. How else can we reframe that? Even this idea of what we've been now is so overused, social distancing. Yeah. That's not what we're being asked to do. We're being asked to physically distance, but we must socially connect. Right. That's key for a professional. I have to socially connect. I need to count on my counterparts that maybe I've never reached out to before. That needs to be also a two-way street. As I'm calling for help and to process, I need to give them space to do the same. Right. Reach out, connect. Understand that license on the wall did not come with a cape and a big S for your chest, right? That this can hurt, and that maybe there is a time you need to step back and just have a grieving cry moment. Remember what we teach our clients, and it's applicable to us as well. Grieving held in is like the pressure cooker that's going to explode. Mourning, when we transform that outside of ourselves and share with another and have a socially condoned way of expressing, we are transforming that internal grief into an external phenomenon that can actually be processed and manipulated and helped and held and carefully fostered as it turns into whatever it's going to turn in for each and every one of us. I think that we need to utilize ceremony when we've lost a client. Take a breath, do some grounding, light a candle, acknowledge that a tragedy has happened and that you are connected in that bigger scheme. Right. I think also we need to be careful about boundaries. I just did a consultation yesterday with a colleague, and the struggle was I want to do tangible things for my clients because they're hurting. So I asked, well, what kind of tangible things? And she said, well, one of my clients is out of toilet paper. I wanted to bring her some. And my question back was, is that something you do for each and every client? And if it's just this client, why? And we really got into a great conversation of we need to connect with resources, but not feel personally responsible for fixing the current problems that COVID has brought into the lives of our clients. Because we can't. That actually isn't our job as a companioner. I think overall, if you don't remember any of these other things we've talked about, acknowledge your humanness. Just acknowledge that you're human and that this is a time of unprecedented sorrow. And in that sorrow, our rage to cure, fear or sanity, right, is going to kick in at some point for most of us. And the best thing that we can do, and I believe I heard this from Dr. Alan Wolfelt, he says, we have 2 eyes and 2 ears and 1 mouth. Use them in proportion. We should be looking and hearing more than we're talking in these sessions. And in companioning one another as professionals, I think we can put those same skills and really uphold our colleagues, because we haven't walked this path before.
So true, so true. And I know that there are, depending on your state and your professional association or guild, they may also have some resources, the peer support line.
Yeah.
So definitely want to encourage people to reach out to your, associations, to your networks.
Yeah.
And one other piece I want to add to everything that you're saying is, taking care of the personal, the human side of loss. And again, we are humans before we stepped into this profession, this way of working.
Yeah.
And we're still in a profession, right?
Yeah.
And, not to be mercenary or anything like that, but we acknowledge there is business tied to this, right? And that is something, a conversation to have with your colleagues, a conversation to have with, if you're in a facility, with your supervisors and how they're thinking about this. So, checking out your resources. If you're losing your caseload, that also has a direct impact on your livelihood, right?
Yeah.
And checking out the Small Business Association or administration and their resources. If you're in a facility, having those conversations with your managers and supervisors, because I know in facilities that provide mental health services, utilization, hours are things that are counted, right?
Yeah.
And so wanted to encourage people to have that conversation too, and that is okay, and it's appropriate. It's not, oh, you're minimizing loss, human loss, but you're also have a responsibility here, ethically. So wanted to encourage people to do that. Go ahead.
There's another piece of this that I've just seen in the last couple of days that I think is interesting. It goes along with kind of the business aspect. Many of our colleagues are being highly pressured by different sources, different individuals to up their caseload in response to this. Absolutely, yes, but within your limits, right? I have a really small practice. I work full-time at an institution. And so my Saturday, my normal 4 or 5 day a week practice, I might extend to 8 or 9 and make it a full day. But I see some colleague shaming starting to happen. If we all reach out and do what we can to help with this increased need, collectively, we're going to meet the needs somehow. That's just how we are. But we should also be very conscious of, we don't know the business circumstances, the life circumstances, the other circumstances of our colleagues. And so we need to really build that source of support so we know who can take who, what type of clients, who's doing telehealth, etc., to build a solid base rather than waste time shaming someone because you don't think they're doing what they should be doing. We're in the middle of a crisis. There's no room for not having compassion for one another as professionals. And that is a very personal circumstance. Now, if somebody's saying, I'm not going to do anything different in response to this, I will encourage them to figure out if there's a way they can within their practice to show that compassion and do some pro bono work or whatever it might be. But I don't know their personal experience. And so I also want to ask us to be conscious as colleagues and compassionate to one another, and all put out what we can and recognize that hopefully globally we will be able to do all together what we need to do, but that doesn't need to fall on any one single person or entity.
Right. So Dr. Flint, I want to again thank you for your time, and really just wanting to, the folks that are watching, this was not to give you all of the answers or to tell you what to do, but in hopes of encouraging conversation for you to think about what can happen over the coming months. Some of us have already experienced the loss of clients from COVID, and some of us have not yet, and yet is underscored, highlighted there. And wanting to prepare our colleagues and investing in one another to take care of ourselves as well as continue to serve our communities. So thank you so much for tuning in and watching. Please continue to check out the new videos.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're still here.
We're still here for you.
If you need help, please reach out. We're still here for you.